Anuwat was a student with me for a number of years at the University of Buffalo and finished his PhD last year. And he's going to present work from his dissertation, um, which he's, I believe, going to continue in the future with new data. So please, Anuwat, go ahead.
Thank you, Dr. Dew, for the introduction. And so, good afternoon, everyone, and who are greeting from early mornings from Thailand. So I'm Anuwat Pengput. Right now I'm a lecturer at the Sinthorn College of Public Health, Khon Kaen, Thailand. So today it's my honor to present here in the ICBO again. So my work is about ontology development and use for the cholangiocarcinoma, risk factor and predictions, determinism-based data analysis, and machine learning classification. So let's start with the cholangiocarcinoma. So the CCA is a major public health problem in Southeast Asia. The prevalence and incidence of CCA in Thailand and Southeast Asia are much higher than other areas in the world. You can see in the map here that the CCA is much very high endemic than other areas around Southeast Asia. So because of the culture and traditions of eating raw fermented, pickle, and undercooked kipina fish, Thailand is called skoi bar, are the key factor for liver flukes of pistocytosis of OV infections. The OV infections produce hepatitis bile duct and portal connective tissue inflammations, and the chronic infections and inflammations have been indicated to be risk factors for the development of multiple stages of carcinogenesis. And several policies have been deployed over the last 40 years to prevent the CCA. The incidence of CCA started decreasing after 2002. And in 2015, the cholangiocarcinoma screening and care program, or CASCAP, established by Khon Kaen University, Thailand, aimed to eliminate OV infection and CCA. So the CASCAP is a prospective cohort study, including the screening and the patient cohort. So the cohort and electronic health records from the general hospitals, or we call it a health data center, and collects data about a patient's demographics, clinical phenotypes with features that have the complex relationships. However, each database represents data elements in different ways and standards. So the CASCAP is the largest and most comprehensive database on OVCCA. So this is the research-based data elements that capture detail about CCA, more specific than those in ICD-10. So there are 6 data collection forms, including the CCA 01 to 05. The first one is demographic information, and the next one is ultrasound, and then the confirmatory diagnosis, and treatment, final stages diagnosis, and the post-operation follow-up. So the next one is health data center. So the HDC is the EHR data warehouse for public hospitals that rely on the ICD-10 time modifications. So the EHR from the general community hospital across Thailand contain data and information on patients with or suspected of suffering from CCA, including symptoms, clinical findings, treatment, and diagnosis. So these works use ontology to annotate the cholangiocarcinoma dataset from the Gerson Provincial Public Health Office, Thailand, which means the data values were interpreted in order to map them to ontology terms. Each patient is associated with a number of different ontology terms, and therefore I can use this as the basis of both querying the data and performing data analysis. So it is possible to look for groups of patients who share common characteristics as determined by which ontology terms they have been annotated with. And so the population and study sample, so the inclusion criteria is the participants who live in garrisons and participated in and provide information in all stages of verbal screening, ultrasound screening, and then they visit hospital related to CCA. So we include on eligible participants that they have information in the database. And then this study is based on data collected from the population in Karasin province, which located in the upper northeastern Thailand. So data were requested to the Karasin Provincial Public Health Office between January 2016 to May 2022, which is the 6-year period. You can see the map show that there is a major river and where the body is. The Karasin province is, I was born there, and it's my hometown as well. And this our work has been approved by University of Buffalo, IRB, and then the GBAB has determined the full HIPAA waiver for this work. And then next one is ontology representation for cholangiocarcinoma. So the cholangiocarcinoma ontology, or CCAO, is the application ontology based on the data item of the cancer form and EHR. So CCAO follow the basic formal ontologies and the principle of ovophary and is developed using OWLs. So the class are imported from other ontologies, particularly ontology from ovophary, such as overons. So many terms related to CCA do not match existing ontology classes. So then we create a new one as needed. So you can see the flow of selecting ontology here as well, and then import to the policy. So this is a step that we here the CCAO. So we start from the translation because the form is in Thai, so we translate to English and then map the data item to existing ontology classes using ontology with the existing ontology, and then we create a new classes from based on NCAT's class and define with the the principle of ontology, and then creating a lot of data, more than 300 data items in a CC form that did not map to existing ontology terms. So we imported classes to protogens using robot tool, and then we are also listening to check the config axioms and also remove relevant class, many remove upper under the upper ontology classes as well. And here we hear the new CCO class, more than 400 new CCO class along with the definition based on data dictionary and also CCO form and silent glitches. So as like for example, the first one is the intrahepatic cholangiocarcinoma with the tech definition is the cholangiocarcinoma that aligns from the intrahepatic bile duct epithelium in any signs of intrahepatic biliary. And we also have a logical definition, is the cholangiocarcinoma and overlap some intrahepatic bile duct. So here is summarized of the number of classes in CCAO, which is under the BFO, OGMS, OB, IO. So we import from many existing ontology like Uberon, Parental, cell ontologies, also drug ontology as well. Here is the cholangiocarcinoma hierarchy in CCAO. So differentiates by anatomical locations and tumor phenotypes. You can see a lot of subclass of cholangiocarcinoma here. And then the simple of logical definition in Polyg of distal periductal infiltrating cholangiocarcinoma. We have the equivalent class as well, axiom as well. And so CCO is developed under BFO, which is now a standard for upper level ontologies using best practice in ontology development, and also compatible with future expansion to represent new evidence and knowledge not be part of this version. And researchers in CCA and ontology domains can use our ontology, and CCA can be indicated with auto ontology, which called is in interoperability with BFO compliance. So I briefly describe about CCAO here as I presented in ICBO 2022. So you can look at the proceeding and Also, CCA version is on GitHub. You can take a look there, use it. And then cholangiocarcinoma ontology-driven data analysis. So we use ontology base for data analysis here. So the overview of the data used in this work is so data that I say is request from the Karasin province, Thailand, including 3 datasets. So the first one is verbal screening dataset, which has the demographic information, dietary information, history of Opisthokish burn infection, and treatment history of CCA related to CCN participant, family, relatives, and medical condition of participant. The second one is ultrasound screening dataset, which has information about clinical suspected CCA, morphology of the liver, gallstone, kidney, and other findings, and also like the conclusion of the physician that they say that they are suspected to CCA as well. And also the last one is symptom and diagnosis, which is the DHR dataset that consists of ICD-10 TMs coded for symptoms, diagnosis, and correlated related to CCA. And so the next one is about a term enrichment of CCA related data. So data that we have that are annotated to CCA conclusion based on data and critical finding subclasses using an annotated script that assigns 30 classes based on data values. Substance of participants are selected based on criteria such as age or gender, occupation, smoking, and other criteria. So these subsets are compared gender participant populations as a whole to look for over or under representation of particular annotated classes. Annotations of leaf node classes are published up to the graph. So also, p-value are calculated with the hypergeometric distribution test, and the Bond-Foronis correction is applied for multiple tests. So the results are visualized graphically with individual nodes colored based on the p-values and whether they are over or underrepresented in the selected group. So here is a conclusion class, and in our C0, so this is the subclass under OBI conclusion based on data. And the next one is the clinical finding hierarchies based on ultrasound screening datasets and EHR data elements. It is subclasses under OGMS clinical findings and image findings. And here is the interpretation of p-value for term enrichment in this work. So there's a two types of overrepresented class and underrepresented class. So the p-value that we have from term enrichment, they will categorize if they are less than 0.05, it will be shaded color on from the like orange and darker to the brown, and if they are underrepresented, will be on the green one. And here the result of our participant with the intrahepatic CCA of the term enrichment. Here is the 186 participant annotated with finding about intrahepatic cholangiocarcinoma based on the ultrasound file results compared to the whole population, 21,000 participants in the group. They're having both verbal and ultrasound screening. You can see the overall here that of the 186 participants here with the characteristics and ultrasound finding and also diagnosis is you can see that is more enriched term in the orange or dark brown is more severe of the participants here. And then here's a zoom in overrepresent this class here. Example is alcohol consumption and smoking. And also like they are farmer attending primary school, the male gender, diabetes, another class that enriched in this analysis. And also they show that the enriched class like peritoneal fibrosis, Type 1, Type 2, and Type 3, also cirrhosis as well. And also the more important thing is dilate bile duct and hepatic mass that are enriched in this class. And also the suspected cholangiocarcinoma, appetite loss, weight loss, and also jaundice that overrepresent in in this subgroup of our participants. And we also did term enrichment with the participant with suspected CCA, but I will not cover in here. I will focus on the cholangiocarcinoma patients. So, and then after we did term enrichment analysis, so we performed a machine learning classification of the CCA patient using a PyCalculus in Pythons with the training size 70% using a stratified tenfold cost validation. If you take a look at the chart, the data set is the imbalance and target here. And then we are for the feature selection, we select the feature based on the term enrichment output that the term or the class that enriched we used for the prediction for the classification. Like we show here again is the term that's enriched in the dark or orange we use as the feature for the classification. So we use a standard metric to evaluate by a binary classification as the imbalance data sets. We use the precision and recall curve as the main to decide which the best performance the model. So here after we run the algorithm, there's a lot of algorithm that did a good job, but we found that the best algorithm for this data set is a random forest classifier for the to prediction of the CCA patterns on the test set. So you can see that precision and recall curves is the highest in here. And then here, feature important for CCA pattern predictions. The age of the participant is the highest important here, followed by the dilate bile ducts in right or left, and also particle fibrosis. So liver mass, and you can see here the share value as well. And then in order to avoid overfitting and also bias in our model, so we run 10 executives of the Random forest classifier for CCA patterns predictions with the trend random seeds. So as it's for the cholangiocarcinoma diagnosis, the main importance that doctor diag or assume that patients have CCA, that when they found that patients have the dilate bile duct or peritoneal fibrosis or also liver mass and also suspect CCA. So in order to remove the bias from the model, so we compare the full model that includes all these variables and then compare with when we exclude these variables from the model. So you can see that when we remove them, that the models is the model performance decreased when remove the full of the indicators, and also with the suspected CCA, when we remove the indicator, the performance declined dramatically. So, but for the CCA, it's not so much decline. And then for the conclusion of our work, so the term enrichments can be used to identify co-occurring annotated class and patterns in a specific subset of patterns that provide insight into risk factor for suspect CCA and patient with CCA as well. The term enrichment can confirm previous finding and generate new hypotheses at the basis for new study. And the machine learning can build off term enrichment results to build highly accurate prediction model for cholangiocarcinoma. So I would like to acknowledge Dr. Alexander Deals for this work, for his help all the thing and I study in at UB, and also for his support in this work, and also Dr. Koiser and the next speaker who also teach me a lot in ontology and give me a lot of push and many things that help me learn about ontology as well. And other people from Department of Biomedical Informatics and also Loyal Thai Government Scholarship for let me study in the US, and also people from Thailand that helped me obtain the data, and Dr. Kawin from Konkan University and Mr. Physics from UC San Diego for helping me about programming. And thank you so much for your attention. I'm happy to answer your question.
Vocabulary